One of the most common operations nowadays are liposuction. First of all, let me remind you that it's not a weight loss operation, it's just to correct the contour deformities of the body. Most of my patients ask me, doctor, I want to lose weight. What must I do? Do I need a liposuction? And I always try to teach my patients and try to suggest them, please try to lose weight and then come back to me and let's define your problems and then we will solve these problems by the liposuction. Liposuction is an operation which we do under general anesthesia according to the areas that we define before the operation, and with small holes we put some small canullas and we infiltrate with a special infiltration solution. This solution has some drugs inside to prevent the bleeding and to prevent the pain, and then we try to emulsify the fat cells, which are the solid fat cells, to become liquid in a liquid phase. Then wait for some time, and then with another special cannula we try to, with the negative pressure, we try to take out the fat cells away. This is the conventional liposuction. But nowadays, with the aid of the technology, we use as third step, just between the infiltration and the suction step, we use a laser liposuction application. What's that? With another special cannula with a ceramic on the top, we give some sound energy inside, which try to take out the fat cells more purified with less blood and less time of recovery, less bruising, less edema, and less downtime period. This is just the aid of the technology that we nowadays use. Nearly, I make all my applications of liposuction with the laser application, and it really enhances our results, especially with a special mode. If we can a little bit more tighten the skin, it's really its results become really more better than the conventional liposuction. According to the area that we choose, it takes 1.5 hours to 2.5 hours, and patients need to stay in the hospital for 1 day because at the end of the operation we put a special post-operative garment over your corset over your body, a tight corset, and some towels inside that. From the holes that we open, the leakage, blood leakage occurs for the first day in the hospital. It doesn't matter. We give you fluid, we give you antibiotic, we give you painkillers, and you will be safe in the hospital. At the first day of the operation, we take out the corset and teach you how to care about the holes, to put antiseptic solution over that, and you will see a bruising and edema at the areas that we make the liposuction. And people are a little bit surprised that how will it define our borders. Yes, it will define, but you have to pass some time. We say that skin redraping time. What's that? When we take out the fat cells beneath the skin, between the skin and the muscles, there are the fat compartments. We take out the fat. The skin does not attach to the muscles immediately. There has to pass time for the skin to attach down. This time is skin redraping time. And when we pass this time with a good period, the results will be much more better. What's that? If it doesn't bleed, if it doesn't have firmness, if you put your corset according to the rules, there must not be a wavy appearance, there must not be a firmness, there must not be a seroma. These are all the complications of the operations, but if you obey the rules, we don't expect them to occur. After the first day visit, we discharge you from the hospital, and the third and the fifth day control follow-ups, you may go to your home. At the first 3 weeks, you have to wear your corset. Sometimes we extend this time to 4 or 6 weeks to see the final result. At the first 15 days, the bruising and the edema will diminish slowly, and at the end of the third month, it means the 12 weeks, you will begin to see the final results of the operation. By the laser application, nowadays we can make a high definition liposuction to give the results and define the lines more accurately, especially for the males at the abdominal area for the six packs areas. We can define these lines of the muscles, and we can create a more male abdominal area for the females also. But these are all according to the patient's needs and patient's desires and patient's body. We cannot choose everyone the same operation, and we cannot change the time. So especially at the end of the operation, you have to be ready to be patient to see the final result. And before the operation, all patients must be ready to make their diet and exercises to be ready for the operation. And after the operation, again, not to gain weight and to make sports will be much more better for you.